A tube that is just a few millimeters in width is so important in all of urologic surgery, maybe kind of the most important device that we use in urologic surgery. Let's talk about why. Let's talk about stents in the ureter. Hey guys, Dr. Segel here. So the question is, do I really need a stent? Please, no, why? So when we're planning on doing a procedure on somebody and we talk to them about the possibility of a stent, invariably they've had friends, family that have had stents in the past and they're petrified about it. And at the end, I'm going to give you my pearl of wisdom for the most important mental coaching tip that we give people in regard to stents to kind of get them through the period of when they have a stent in their body. So stay tuned to listen to that for sure. So this is one of the things that patients always ask us about. Doc, can you do the surgery without a stent? And I think let's talk about some of the reasons why we place stents, and then it'll explain why we need to keep stents in for surgery. So what is a stent? First of all, so it's got a curl. Let's draw it in this kidney here. It's got a curl in the kidney. It goes down the ureter, and then let's draw it down in the bladder here. Let's say the bladder's down here. Okay, so one curl in the kidney, down the ureter, curl in the bladder. So a lot of people think when I take a stent out and I show it to them, they think it's going to be this long. It's actually oftentimes this long. So that's what a stent is. Probably the most common incidence or time that we have to use a stent is when we do something called ureteroscopy. That's when we look up the ureter, which is the tube that drains urine from the kidney down to the bladder. We find a stone, we apply lasers to it, then we have to leave a stent in. The reason why we have to do it is because we don't want that ureter to close up. So we've done a lot of work to try to help the patient to get rid of this stone. But whenever we put a foreign body anywhere in the urinary tract, it can get swelling. If you get a scratch on your arm, you're going to get swelling there. It's going to be inflamed. It may look bigger as it heals before it kind of gets smaller. The same thing happens in the ureter. When you put a foreign body, that scope, into the ureter, and that acute period afterwards, it's going to swell some. When it swells some, we don't want it to swell so much that it closes off the flow of urine. So if that happens, urine's going to back up behind the swelling, and it's going to feel like the exact same pain with a stone. So oftentimes one of the reasons why we leave stents is after ureteroscopy or after going up there with a scope and applying lasers to the stone to allow that acute swelling period to resolve, to get better. Then we can take that stent out. So one other reason why we place stents in is something that I kind of call prophylactic stents, or if we think there may be impending obstruction. Obstruction's about to happen. Let's take a look at this stone over here. This is a non-obstructive stone in the kidney, all right? This is not causing any problems right now. If we were to drop into this location, it would. But right now, it's not causing any problems. Sometimes, for a variety of reasons, we'll apply shock waves to this stone. Sometimes we'll go through the kidney here and access this stone and remove it. But what can result are some small fragments, right? If we apply shock waves to them, if we go through the side of the kidney and get this stone, there can be some dust or sand-like particles that result here. They can get lodged in the ureter and cause an obstruction. So oftentimes what we'll do is we say, you know what, this is a big stone that we're working on in the kidney, even if it's not with a scope, a ureteroscopy, so we're not going through the ureter. But I think there may be an impending obstruction when we start working on it. It's kind of like tickling the dragon's tail, right? So we'll place a stent from the kidney down to the bladder so that if this obstruction were to happen, there's a way for urine to get from the kidney down to the bladder. And then we keep it in until we get some imaging over time. Say, you know what, it looks like the stone's cleared, then we pull that stent out. So it's to kind of obviate or prevent a problem from happening when we work on a non-obstructive stone. So that's another reason why stents are really, really important. Sometimes we'll see, this is another reason here too. It prevents obstruction from an extrinsic source. So let me explain what that is. Extrinsic just means outside the point of reference for in the body. So in the ureter here, this stent, let's say, God forbid, somebody had a lymphoma, they had a colon cancer, they had some type of obstruction in their abdomen, in their pelvis that's preventing urine from going from the kidney down to the bladder. So let's say it's here, and it's pushing on that ureter. And when it pushes on that ureter, it squeezes it. Urine's not able to get through, and then you get swelling of this kidney. Well, a stent can liberate that urine from the kidney down to the bladder. So we'll place a stent in individuals oftentimes with certain cancers that have nodes that are pushing on the ureter, masses that are pushing on the ureter, and we'll keep those stents in place until those cancers have gotten better, until we work with the oncologist to figure out a good time to take those stents out. We oftentimes want to leave these stents in while they're getting chemotherapy because we want their kidney function to be nice and healthy and strong while they're getting chemotherapy. So that's another circumstance where we use stents. There are emergent situations where we put stents in too, which I want to talk about. So this stone here obstructing the flow of urine, if there is an infection behind it, so if there's an infection here in the kidney, the two principles of drainage, the two principles of therapy with a urinary tract infection and obstruction are: number one, give antibiotics, straightforward. Antibiotics, fluid, what we call supportive measures. But the second thing that's really important is drainage. So we can give all the antibiotics in the world that we want. If that urine up here is infected and it's not getting out, those antibiotics won't be effective. So we place a stent because then it, again, liberates or pulls that urine from the kidney down into the bladder to the outside world. So that bacteria that's getting affected by the antibiotics is also getting to the outside world. So it helps us relieve urinary tract infections that are associated with obstruction, oftentimes in the setting of or when we see obstructive stones preventing the flow of urine. So that's another circumstance where stents are super, super important. One thing in people, when they hear a stent, the first thing they think of is a heart stent. And then the next thing they think of is that this is a permanent thing that's going to be in my body. It is not a permanent thing. Stents have a lifespan usually of 3 months or less. That's important because you got to make sure that you see the urologist back to get it removed, changed, the original problem taken care of. I've seen patients that have had stents in for years and years and years because they didn't know that. And then it's a big problem. It's a mess trying to get them out, trying to clear those stones out can result in permanent infections of the kidney, permanent kidney damage, etc. So I want you to know, as a very important concept, these are temporary stents, which is a nice thing too, because then you know that any discomfort with a stent is a temporary thing. It's not a permanent thing, okay, to be clear about that. Stents also help things heal, and that's another reason why we use them as urologists. When we do surgeries where there's surgeries that we do robotically where we will cut off the drainage from the kidney and the ureter and sew it back on itself. If there's an intrinsic obstruction there called a pyeloplasty, we'll leave a stent in for 4 to 6 weeks to help that area heal up. So if there's less pressure on the area, it's decompressed or it's drained with the stent, that tissue will heal up on itself. Okay. Sometimes we'll be in a trauma situation. So if there's a gunshot wound to the abdomen, if there's a damage to the ureter intraoperatively by us or by another surgeon, then we'll fix it, leave the stent in for a number of weeks because, again, taking the pressure off that area with a stent will help it heal in the long term, to be clear. And finally, we're going to get to my pearl of wisdom. And this is the mental coaching tip that I try to give all my patients about how to wrap their head around the reason for having a stent and how it will help them kind of for the rest of their life. So this little tube will cause some discomfort in the short term, but for all the reasons that I said, it will likely help you in the long term. So the whole time that you have this stent in place, I want you to remember that it's going to cause some short-term discomfort, but in the long term, it's going to be a device that we use to protect your kidney health permanently, okay, to relieve obstructive in the short term, which can improve your kidney function in the long term, and it's going to prevent long-term problems associated with obstruction when we do these procedures. So a short-term discomfort will result in long-term improvement in your overall kidney health rather than not putting a stent in many circumstances. I hope that coaching tip can get you through this acute period when you have a stent in. Remember, it's just a temporary thing. Put your mind in a place where you know this stent is going to be gone some days because it usually will. And that's everything that I have to say, guys. So I hope that's helpful for you. I hope that gives you some guidance as to why we place stents, why they're important. And at the end, I hope that you can use that piece of information to get you mentally into a place where you know that this stent is going to come out someday. Thank you so much for listening. We certainly appreciate it. Please subscribe to our channel. Thanks again.